So I want to welcome everybody today. Hello, I'm Diana Lum. I'm with the Greater East Quad Chamber of Commerce, and I want to welcome you to our Business Solutions webinar today. We are excited about today's topic, understanding the vulnerabilities and ways to mitigate risks associated with our personal health information. But before I go and introduce our expert presenters today, I want to let everyone know that we are proud to bring this webinar series to our business community. We want to support your success, and we bring varying topics every month to you, from marketing to cost-effective health benefits, how to cope with work stress, burnout, to business credit 101, and so much more. You can access this recording as well as our other resources through our website at issaquadchamber.com. So today, again, we're excited to have our experts with us, and I'm going to introduce them. So Ashwin is the owner and president of TeamLogic IT in Renton and Kent. It's a franchise that addresses small and medium-sized business IT needs. He also owns and operates multiple retail businesses such as a Chevron gas station, convenience store, and health food store. Before embarking on his entrepreneurial journey, Ashwin worked for 17 years in big tech companies such as Microsoft, Expedia, and Siemens, where he spent time in both product development and IT management. During his time at Microsoft, he managed tools that were used by IT managers, asset managers, and network engineers to run IT infrastructure in Microsoft data centers. With experience in both business and technology, and very, very busy man, obviously, Ashwin understands the various IT needs of business owners and uses technology to help businesses grow and succeed. And that's absolutely why we're all here today. We also are honored to have Ari Van Persum. She is the Director of Business Development at MedCurity. Ari leads strategic initiatives in marketing and sales, along with building the partner program. She is on the forefront of industry education when it comes to HIPAA compliance, regularly speaking in webinars, partner engagements, and conferences. She is passionate about re-educating healthcare's mindset towards HIPAA, as she believes it can be used as a strategic protective tool. She grew up here in Washington, but now calls Spokane her home. She enjoys being part of the startup and small business community, contributing to the local economic development. And we thank her for that work as well. So it's great to have you both with us today. I will turn it over to you, Ashwin or Ari. I will let you take it from here.
Thanks so much, Diana. It's such a pleasure to be here and get to present some pretty critical information alongside Ashwin, who's doing some incredible work in the community in Renton and Kent. And so getting to share this information is hopefully going to be pretty beneficial. We just did introductions, but in case you need to see our titles again and our company again, there you go. It's really a unique space to be operating in when it comes to security and supporting the technology within companies. I know Ashwin can speak to that quite a bit. On the MedCurity side, right, our world is HIPAA compliance. So to make this presentation as relevant as possible to other industries, my hope is to share from the patient perspective as well, since we're all patients that go and see dentists, providers, specialists all the time. So you can understand what's going on the healthcare provider's side of the conversation when it comes to HIPAA, as well as how critical the conversation is right now. So the agenda is pretty simple. We want to explain the current landscape of cybersecurity, and we want to define what the actual HIPAA requirements are. It's not just that document that you sign when you go and have patient forms in the doctor's office. It's far more extensive. And then practical next steps. Want to make sure this is actually digestible and you leave feeling like you have some actionable items, whether you're in healthcare or just needing to evaluate different pieces regarding your own cybersecurity. So we'll start with the landscape. Just to set the scene here, it is not to scare anyone or be a fear-mongering tactic at all. That is not our heart behind this. However, we would be doing everyone a disservice if we didn't share what the reality is at this point, because the threats are so high and they are continuing to evolve. So there's this really interesting report put out by IBM for 2022, and ultimately healthcare came out as the highest targeted industry across the globe for the last 12 years. So they've got a pretty unfortunate streak. And not only is healthcare the highest targeted, but if you pivot to regional stats, the United States has the highest average cost of a breach compared to any other country in the world. So we paired those two stats together, and we know healthcare in the US is the most targeted and the most costly industry out there right now. Next up would be financial institutions, financial services, as well as higher education, as well as government entities. So the list goes on, but basically all industries are not exempt from cybersecurity. And so this is something to keep in mind as I share stats and what the reality is. Looking back, excuse me, at 2022, I am a firm believer that if we look back at the trends, it helps shed light on what the future is going to look like. So knowing that, there is this informal breach website. It's informally known as the Wall of Shame. So the Office of Civil Rights is the enforcement arm of the government that would essentially go to your healthcare provider and say, you are not securing data like you're supposed to be. So it's this federal entity that you don't want to get a knock on the door from. They have a portal, like I said, informally known as the Wall of Shame, where if you have a breach over 500 records in their practice, they have to publicly post it on this site. So you can go and publicly look at it. It tracks back to 24 months of data. So there's a lot of data there that you can track in terms of trends, who's been targeted, and it doesn't take much to find what's happening in your local state if you want to make this relevant, which I'll show some examples here in a minute. But overall, I went through the data and I found that in 2022, almost 50 million records were breached, which is a ridiculous amount of records, and it continues to grow every single year. And what's interesting within the number of breaches that happened, what's not super surprising is that 78% of those breaches are classified as hacking/IT incidents, right? So we know our world is heavily reliant on the technical space, but it just goes to show there's a lot of value with our networks and how we segment and how the technologies and the softwares that are out there, but there's also a large amount of risk that's associated with it too. So the other unique thing, which is going to be a theme in our conversations throughout this webinar, is that 39% of those records that were breached through business associates. So business associates is a term in healthcare, but it essentially translates to other industries as any vendor that you use. So if you're giving access to any third party to your systems, whether it's your payment system, how you schedule, maybe it's your supply chain vendor, those are all contractors that you're going to want to make sure that they're doing their due diligence with security, because we're seeing a massive uptick in terms of your vendors, your third parties getting breached and getting access to your systems. So that's something to note, and that's ever increasing also. I always add in this note about education just because it's something we don't often think of. So there are a lot of university centers out there, that universities that have medical centers connected to them. And so we've been seeing trends where we call them bad actors, people who are trying to break into your network, steal your data, are going the university route because it's the education part. Maybe they don't have their attention on this as much as healthcare. And by that way, they're getting into medical systems still. And that impact is up 73% from the year prior. And then the next two are really interesting just because if there's one thing that I feel like across industries, most people understand after the last couple of years, is that phishing emails are so prevalent. You get emails all the time from like, oh, your invoice is ready, time to pay. Or historically, they were really corny, like some sort of prince from a different country asking for all this money, right? But they've gotten really sophisticated to make it look like it's your supervisor asking for a wire transfer, which could almost be realistic. So phishing and ransomware attacks really remain the highest threats today, and that is not specific to healthcare. That runs across every single industry. But specific to healthcare, some stats, they did a large survey against about 100 healthcare executives in small to mid hospitals, and they found that 81% of those groups were experiencing phishing attacks. And then what's interesting next to that is only 1 in 5 of those organizations were actually running tests against their organization to make sure that they're training them against this. So the impact and how we're testing, there's a huge disconnect there. So that's a large takeaway, I would hope, is that people recognize phishing is not going away. It's just going to get more sophisticated. So we need to be sending simulations to our employees and testing them and training them to be paranoid. That's the best way to put it at this point. And then lastly, so I like to share where there's a lot of focus from the Office of Civil Rights, right? That enforcement arm. Right of access is essentially this initiative from the government that said, we want to make sure that patients are getting access to their information in the appropriate period of time. So your provider has 30 days to respond to any type of medical request that you send. They do have the ability to deny a request, but they need to have sufficient reasoning for it. However, if they don't respond in an appropriate period of time, that's defined, which right now is 30 days, you can actually, as a patient, go report them to the Office of Civil Rights, and this has been happening quite a bit. So then investigations incur, and then so do financial penalties. So it really only takes one person to go complain to the government, and that could open the provider's door to an audit. And then just to put this into perspective of who it's happening to right now, right? We talk about ransomware being the highest area that's affecting healthcare right now. Oklahoma State University just paid a settlement mid last year. That was almost $1 million. And that was a ransomware attack. A bad actor got into their network and held data hostage. And it's just to a T what's happening to any type of organization right now. It also happened to Common Spirit Health, which is a massive organization. They span from our Washington state to Tennessee, Wyoming, Texas. Like, they are in so many states. And they experienced a ransomware attack against their EHR, which handles medical records. And so that's where your MA or your PA is logging all their notes during your session. And we want to protect that data as much as possible. So it's happening left and right to these large groups as well as small groups. And then it happened back in February of this year. So a month ago, it happened to a hospital in Maryland. So that's something to just keep in mind. But I really wanted to bring it home and relevant to Washington State, right? I can talk about ransomware attacks that are happening all over the US, but in Washington State, there's actually a data breach portal like there is nationally for the Office of Civil Rights, but it's just for Washington State breaches. It's through the Office of the Attorney General. And I went and looked up the most recent data breaches in Washington State. And there was one that happened in December of last year, but it was reported in February for Evergreen treatment centers. So I looked up the story behind it. And when you experience a breach like this, you have to publicly report it, right? And that includes a press release. So there's information about all these breaches out there if you're ever interested of learning what's going on. But what happened here too is a bad actor got access to their network, accessed patient information files. And so once they discovered it, they shut everything down, but then they had to offer identity theft protection services to all the patients, credit monitoring, right? And it's a nasty process to have to go through once that happens. So if you ever do get an alert from your provider about that or your hospital, that's probably what happened behind the scenes. And then I switched back to the wall of shame. So the national reporting stage here. And I picked up on another Washington State breach, which is integrative dentistry. looked up that incident as well, and it is also someone's network being attacked and they got access to patient information. So obviously the details behind it are unique for each case, but moral of the story is if your network is hacked, it's really not great for the patient information. It's something you're going to want to report immediately, or if you're the patient, you're going to be hearing about in the months to come. Last but not least, just because there are so many examples out there, these are massive scale breaches that are hitting millions of people. So you can actually see on these last slides right here how the Evergreen Treatment Services affected about 21,000 people, and integrative dentistry was just over 2,000. To put into perspective the size of these breaches, so in California, Regal Medical Group found malware on their servers, which the difference between a ransomware attack and malware, it really is that they'll get into your system and you don't know they're there, and then they'll install something that just sits. And then it expands and grows and gets way worse over time because it's hiding on the network, without getting too technical here. So that was a really unfortunate breach that happened. And then recently, Banner Health, which is one of the nation's largest nonprofit health systems, recently settled over $1 million breach $1 million settlement because of a breach that affected 3 million people. So based on all that information, because I feel like I've made my point in terms of what's happening, it's happening left and right. What do you do with it? What are some trends we should consider in this coming year? So regardless of your industry, right, I give a lot of healthcare examples, but this is happening in construction, in finance, in gas stations. It's really interesting who gets targeted, because you realize they don't necessarily care what kind of data you have, because they know you'll want it back and that you'll pay for it. So IT investment is everything right now. We need to continue to prioritize that. So whether that's companies that you work with to manage IT responsibilities, or moving your data hosting into the cloud, because there's a lot of security measures that come with that. There are a lot of different ways to consider this, which Ashwin would be an incredible resource on this. He'll know a lot more about how to personalize IT investment depending on what your industry is and what your organization looks like. But what we know is that 59% of our breaches are in the network, 23% are because of emails. So those are two really targeted ways to start. We need to invest in our network. We need to train our employees on phishing emails. So vendor risk management, I touched on this a little earlier, but your third-party risk, right? We need to take our contracts extremely seriously because there's risk that we inherently opt into when we do business with other companies, right? So for healthcare, this looks like who manages your medical records? Do you host your data on servers in the cloud? And then your IT vendors too. And there's some really great partners out there that do a great job of managing their risk, but there's also a lot of vendors that do a very poor job. So asking the questions of what they're doing is absolutely within your right, and we encourage you to do so. Internal audits, it's a really great place to start just to see how you're doing as an organization when it comes to your risk. So for healthcare, this looks like a security risk analysis, evaluating where your risks are and then creating a plan to do something about it. In other industries, it really has to do with maybe it's a system efficiency tests, maybe it's risk analyses against your supply chain, right? It's planning for when the bad thing happens. Do we have all of our weak links identified? That's really the goal here. Disaster recovery plans is a part of that weak link, right? Because when your power completely goes out, what do you do to protect your data? What's your plan? When there's a hurricane, depending on where you live in the United States, and I'm realizing that's not the most relevant for Washington, but we do get a lot of snow and a lot of rain. So if your facility floods, do you have a process to come back from that? And what's that plan look like, especially if your servers are hosted in the basement? That's something to consider. And then last but not least, this really is pretty specific to healthcare, but website tracking technology has been a really big conversation, which they call them pixels. And what pixels do is they are pulling all the information from different websites and sending them to third parties to promote against it. So for example, what's happening in healthcare is if let's say your local rheumatology practice has a pixel on some internal facing websites that should not be sharing information like what kind of medication each kind of patient has, it's taking that information and sending it to third parties. And then the patients are going to start getting ads for their rheumatoid arthritis medication. And that is absolutely a breach of privacy. So we're seeing a big uptick in that. And that's something to consider to focus on. So I come back to the Washington State Data Breach Portal because I wanted to highlight a group that is not in healthcare, but they recently had a data breach. So Northwest Mothers Milk Bank had a lot of information about milk donors, outpatient records, right? And they worked with a third-party system called Timeless Medical Systems to host all that data. And that third party got breached. So what's interesting to note here is that Northwest Mothers Milk Bank had to report it, not the third party, right? It's because if you think about where the data originated, it's with the milk bank. It's not with the third party, even though the third party is at fault. So when we come back to the conversation about vendor risk management, this is why, because your vendors could have a breach. So what do the details of your contract say about if there's a breach, whose responsibility is what, when do they have to notify you, right? And that is across all industries, not just healthcare. And this example proves that. But it makes a lot of sense to hear from an awesome vendor who manages their risk really well in terms of what he's seen in the field, Ashwin. So if you want to speak to what are the most common things that happen.
Oh, thank you, Ari. And yes, that's a great introduction. Talks about who's affected by cybersecurity, what you need to look for to help protect yourself, questions to ask your vendors and stuff. That's a good introduction out there. And like Ari mentioned, things happen, and it happens to your fellow business owners themselves, right? You might think that, hey, I'm a small business owner, it shouldn't happen to me. It doesn't in fact matter anymore. And the more and more, if you look at it, the latest trend is more and more small business owners and medium business owners are getting affected by this cybersecurity, including phishing and ransomware as well. So I'll give you an example. I'm part of a networking group, BNI, and this was an owner, business owner. She owns a multi-location print shop, and their office was basically, taken for ransomware. And then, so we consulted on recovery and gave some advice. She was not my client, but then I'm happy to help in this situation. The business owner decided not to pay the ransomware because the amount asked was pretty high, but still, the business owner decided they didn't want to pay for it, and they did not have cybersecurity insurance coverage as well. They lost a lot of productivity. They lost access. They lost graphic work, artwork, and all the client contracts and contacts as well. And so it was a tough time for this business to get back on its knees from where it was. And they actually were using in-house IT, meaning one of their family members was supporting their IT. So there's so much you have control based on, if you want to use one of your family members for going cheap, then essentially you are being based on the mercy of what you know from what your family member knows. You want to bring in the experts to handle your IT. It goes back to that, right? And so I just wanted to share that example of that. And then there was another example I'm talking about one of my clients. Basically, he's a business owner. He owns an investigative firm, insurance fraud investigation, and they are multi-location as well. And he lost access to his email because he clicked on a phishing email on a link that was provided, and then his contacts started getting phishing emails. So one of the contacts, business contacts, reached out to him and said, "Hey, I received a funny email. Is this you? Why are you asking me this information?" Right? And that's when he came to know something went wrong, and then he escalated it to us. We were immediately able to jump in, do an analysis, do a diagnosis, and we immediately fixed the problem. But there was also an educational process. Right after this, the business owner agreed to work with us to set up a training module on cybersecurity for the entire staff, and we are working on it to get it going for them. So I will later cover that in the later slides, but just wanted to give you a couple of incidents that have taken place recently that I wanted to bring it up and highlight here. Off to you, Ari.
Thanks, Ashwin. Such great examples, and those happen every single day. They're very common, very, very common. So moving to what actual requirements under HIPAA look like. I'm going to speed through some of these slides because they are very specific to healthcare, but it's good to know from a patient perspective what your provider needs to be doing. So HIPAA was signed into law in 1996, so it's been around a very long time. However, HIPAA is defined by two rules, the security rule and the privacy rule. So the privacy rule came out in 2000 and the security rule came out in 2003. So this is how most legislation with the government works, is they sign something into law and then people have to go write the rules of what we actually follow for the law. So then not much else happened until 2009 and 2013, where the HITECH Act and the Omnibus Rule came out, which ultimately pushed HIPAA requirements onto healthcare third parties, which we call business associates. So now these groups also have to be doing HIPAA exercises and activities. So that's how it's evolved so far. And what we're waiting on right now is an update to the privacy rule. So updates have been rather slow to healthcare HIPAA compliance, but for the most part, the framework is helpful. So under the privacy and the security rules, we have different categories. So the security rule breaks down into three: administrative, technical, and physical. Administrative really has to do with, right, your organization-wide processes and policies, like sanctions for your employees. What are the consequences if they look at patient information? Or what does your disaster recovery plan look like? And how can you still see patients when you have to immediately move your building? Something like that. Technical really has to do with where your network security is, how you're auditing your network, those types of details. And physical is your physical environment. So looking at if your doors are locked, finding out if patients can see doctor computer screens when they're walking through to get to their patient room, right? So it's something to note when you are going to see the doctor, is like, can you see patient information around you? Something to know that it's a sign of HIPAA hygiene per se, in terms of how well they're securing information. And no doctor's office is perfect. Don't try to go in and say, like, you're not doing anything right, but it's just often a good reminder for them that patients do care about this. So what is your patient information? It's your name, your geographic data. So that's anything that attaches you to that practice or to that dentist's office. So if they accidentally leak your driver's license number and it's attached to them, like, it's that kind of detail that you want to avoid getting out. Who has to comply with HIPAA? It's your dentist office, but it's also your insurance company, Primera, Kaiser Permanente. There are quite a few insurance providers out there, and those are called health plans, healthcare plans in the healthcare world. So, and then healthcare clearinghouses are these entities that essentially reformat data for healthcare companies. So because they have access to that proprietary data, then they also are considered a covered entity, which is on the healthcare provider side. And then, like we talked about, business associates, those third parties that are doing work on behalf of a covered entity. So the requirements break down into these 5 things. So your security risk analysis, evaluating where your risk is, then your risk management plan, which is taking all the risks you identified and turning them into action items and saying, this is what I'm going to do about it. It's also having policies and procedures that define what you're supposed to do in the event of a breach. What's your response to an incident? Or it's defining your sanctions, like I said earlier. So those are the framework of your organization. It's also business associate agreements, so those contracts with your third parties, and then it's HIPAA training. So that goes in line with training on phishing emails, but it's also training them on what patient information is and what not to share with people. So just quickly, what's included in a security risk analysis? This should be happening annually. It can be done by another group, but it can also be done on your own as a healthcare provider. There are pros and cons to getting it done by yourself. Pros are the cost will be cheaper. Cons, it will take up more of your time. It might not be accurate because you just don't know what you don't know sometimes about HIPAA. And so it's good to consider to have a different group do a security risk analysis for you, just because their perspective is objective. They're not in your day-to-day. There's a lot of value to it. But according to HIPAA, you're not required to do it one way or the other. Accurate and thorough. This means it needs to be true to what's happening. So even if you spot something bad, you need to document it. Because one of the worst things you can do is document how you think things should be, not how they are. Because there are different tiers of financial penalties within healthcare, and the highest one is negligence, which means you know it's a risk and you chose to do nothing about it. So something to keep in mind. You aren't penalized for having risk. Also keep that in mind. Part of the SRA is evaluating your policies. You need to make sure that they're up to date with how your processes have changed, as well as what's actually happening. You can say that your workstation's time out after 3 minutes or 10 minutes, but if you go and wait and watch a workstation and it's not timing out at all because that workstation has administrative rights and it shouldn't, that's the evaluation that you need to make sure the procedure is matching what your policy says. And so the whole point is to find the issues. It's not necessarily to just check a compliance box. That is a function of it. However, the goal here is to help you decrease your risk over time. And then that risk management plan is pretty straightforward, right? All the risks you found, we're now going to create a plan to address those. I typically show these next couple slides just to give people a good snapshot of what security and privacy policies should look like in terms of the content. So I know I've mentioned sanctions a couple times here, but workforce security is also important, and that looks like what kind of access to systems your employees have, or making sure that you have no workstations that you can just log in with no credentials, right? Security and awareness training, that's really critical. Workstation and device security, that's what your log-offs look like. Are your mobile devices encrypted? And then we move to facility access controls, what doors are locked, who has access to the server room, and then that contingency plan policy, what do you do if worst case scenario is happening? And then moving to privacy policies, this one is probably more familiar to from the patient perspective than any other policy we'll talk about. But when you go to your doctor's office, there's probably a poster on the wall that says, these are your rights as a patient. You also receive one or are asked if you want a hard copy of your patient rights. But you always have to sign off that you have read them, that you've received them. And what the notice of privacy practices covers in that is saying, if there's a breach, you understand that you won't necessarily take legal action, or you understand that you may be notified that there's a data breach, right? So those details are actually rather important to read through. I don't even read through them, so I totally recognize why people don't take the time to, but just know that's what you're signing off on. And then it digs me even more into, right, access to information. So your dentist or primary care provider will have policies that say, we have 30 days to get our patients their information when they request it. Or social media policies. If you write a review on their Yelp page or maybe their website, there are rules to how they can actually respond to you and acknowledge that you're a patient there. And then with remote work and telehealth, I'm sure most people have experienced a telehealth appointment at this point with how the past couple of years have gone. And so there are new workflows and security measures that need to be taken into account on the healthcare provider side. So moving on to policies quickly, they do need to cover security and privacy. And so if there are ever any healthcare groups listening to this, your policies do need to branch beyond your notice of privacy practices. They just do. So if they don't, could be a really good time to have a conversation with Ashwin about this. Beyond that, employees do need to have access to these policies. They need to have read them, know what's in them. And you also need a team that is updating them. For business associates, this one's really applicable across industries too. Make sure you have a master list of all the vendors that you work with, as well as any type of system access that they have, maybe sensitive information that you've sent them. Keeping track of all that is really helpful, even down to, let's say they need a key to access your facility, because if there is a day that comes where they're no longer working with you, it's a central way to look and say, this is where I need to cut off access because we no longer work with them. And so for healthcare specifically, we want to make sure that they don't have any more access than they need to patient information. So that's a good thing to include in those agreements. And business associates have to do HIPAA compliance requirements as well. So it's within your right to ask about that. And then according to HIPAA, when it comes to training, it needs to be done upon hire and then annually. Those are the two really explicit requirements in HIPAA law. Beyond that, they require security and awareness training, which would be more in line with like what Ashwin was describing earlier, like cybersecurity module training, where you're sending out these courses. And that's something that should definitely be considered across industries as well. And in healthcare, training on new procedures or technology should happen pretty quick after they've been implemented. So moving forward, specifically for healthcare, you need to complete your security risk analysis. It's like the baseline to your HIPAA compliance program. So if you have not done one in the past year, it would be your highest priority, I would say, because if you don't know where your risks are, you're opening yourself up to potential financial penalties, downtime, losing access to your email, like Ashwin said. So do that first and foremost, and then create that plan based on what the risks are. And it really helps to have a partner in this who has walked through it and knows what to prioritize and what to get in place. And then review your policies. And if you don't have policies, build some policies. It definitely needs to be there and be in place. And I'll explain why on the next slide. And then check your procedures, right? Just walk through your clinic, walk through your facility. Does it match with what your policy says? If not, revise your policy. And then if you don't know who all your vendors are, get a master list together. And lastly, let's train our employees to set them up for success in the world we're living in. So why all of those baseline HIPAA compliance requirements matter is because what happens if there's a data breach? Well, the Office of Civil Rights, that enforcement entity for the government that I've mentioned throughout this, they will come knock on your door in healthcare and they will say, they might request any of these line items. So if you look at the highlighted ones, what are they? They're your security risk analysis. It's your policies and procedures, your risk management plan, your training program, the list goes on. So what we've learned from being in this industry is what you'll be audited against is exactly what they ask you to do in the first place. So that's why I'm so passionate about re-educating on this, because it's not just checking the box and thinking that HIPAA compliance makes absolutely no sense, but it's getting these items in place, knowing where your risk is, because one, the chances of you having a breach dramatically decrease, and two, you'll be able to defend yourself from financial penalties if you have them appropriately in place. And then this last slide is probably one of the most important things to be prioritizing right now across industries, right? Because we have shifted our mindset from not if we experience a ransomware attack or a data breach, but to when I experience a data breach, do I know what to do? And so what that looks like is it's actually testing your plans. So your data backup plan, if you have a company that does data backups for you, but you have never seen them test it or seen a report, go ask them for a copy and get on a regular cadence to get that done. Same goes for disaster recovery plan, right? Go through an entire scenario and make sure that every piece across your organization actually knows what to do. If there is downtime or you can't access your systems anymore. And then application and data criticality analysis. This is a really interesting place to start, I would argue, in terms of doing an assessment to figure out which pieces of your organization actually are critical to operating. So if you had to get rid of 90% of what you use, could you still operate in a basic manner? But how we continue to keep our systems compliant or secure, depending on your industry, right? It's making sure that we're actually looking and auditing to see what's happening in our systems, which I'm about to pass it off to Ashwin so he can share about what this actually looks like on the IT side and how to do it really well. But one last note here on the healthcare side is your chart audits. So if you are in healthcare, something to consider implementing, if you don't do it already, is taking a sample size of your employees or patient charts and making sure that your employees are only viewing the charts that they need to. And if they're viewing charts outside of their scope of work, that would be considered a data breach. So that's where I'll leave it on the system audit side from my end, but Ashwin has an incredible perspective on how to implement better solutions for this.
Thank you, Ari. Ari, if you could go to the next slide, please. Yeah, thank you. So what I'm going to do is in the next two slides, I'm going to talk a little bit about what do we, from a technology standpoint of view, what are the services we provide for our clients who are interested, for our clients and prospects who are interested in helping protect their business information, their IP, and then as well as patient information as well, right? So I'm not going to delve into the technology, but I'm going to delve into a little bit about the services, and then obviously the green boxes are the ones which talks about what kind of technology we use. In some of these services, the blue boxes, which you're seeing, those are the services we have, and then we might use one or more technologies to support that service. So for example, for remote monitoring and management. So if you have workstations, desktops, and servers on-prem, how do we make sure that we have protected your device, and we as an IT provider are able to log in and manage those devices? We use multiple remote monitoring and management tools. We also provide network operations center, from a third party to monitor your environment 24/7 if there is a requirement for that as well. We also provide patch management. You want to have patch management to make sure that your systems are patched for all those security loopholes in the application as well as in the operating system for both your desktops and laptops as well as for your servers as well. So we provide patch management, and that's a service we provide as well. Backups is one of the things that Ari touched about. And it's very important that you decide as a business owner, what is the data that you need to get backed up? Do you have a file server that needs to get backed up? What kind of backup do you need? Do you need a backup on-prem as well as to a remote location, as well as to a cloud? So those are questions when we are talking to you about the service, we would be asking you and getting information and also providing information to help make those decisions. And and we also test those backups to make sure that we are able to restore a last known good state of your business information, right? So we do that as part of the service as well. We also provide endpoint security. So endpoints here refers to the workstation, desktops, your servers, and your network equipment and stuff. So we provide antivirus, anti-malware, and other necessary equipment to help protect your environment, in IT infrastructure environment in your office. Or if you have multiple locations, it also includes that as well. And if you have employees who are working remotely as well, so we need to make sure that their computers that they're logging in from is also safe and secure when they are trying to connect to your business environment. We also provide help desk and ticketing. So if you are a bigger organization that needs a more organized and better way for us to communicate with the IT vendor, we are there to help you provide the ticketing system exclusively for your organization. And we provide help desk services as well as part of that. Can we go to the next slide, Ari, please? Thank you. So this slide talks a little bit about what are the cybersecurity essential services that we provide for our customers. Like I mentioned, the blue boxes are the services, and the green boxes are the technology that we use to provide those services. Sometimes we use multiple technologies to support those services. DNS filtering is basically making sure that we are able to filter your web browsing activity in your office. We work with the business owners and we provide and restrict certain access to websites and stuff. We also provide encryption for your email, encryption for your data, including in the disk. And so this is very important if you have sensitive information that includes EPHI that needs to be protected. Encryption is a great way for you to protect your data on site. And so that's something we provide that as well. Email protection, right? So how do we make sure that your emails are secure, safe and secure? Spam is controlled. And also, if you have a situation where you have to send encrypted emails, how do we do that? We provide all those features and services as well. And then we also do assessments, cybersecurity assessments for you on a regular basis. If you are interested in doing that to help understand what your current environment is and how we can make recommendations. And we also, as part of that assessments, we make recommendations and then work with you to fix those issues identified. There's also a very important aspect that several of the people don't even realize it, and they've started talking about it and thinking about it now as awareness is being created, is your employees is your best line of defense, but they can also be your weakest link. So as long as you can train your employees to help understand what phishing is, what cybersecurity, making them cybersecurity aware, they're your best warriors. And at the same time, as long as you can train them and equip them, they can defend you. But if you don't do that, they can be your weakest link as well. So we use multiple tools to support cybersecurity training and testing. There's tools in there in the green boxes. We also provide dark web monitoring. Remember, dark web monitoring is basically where all the data that's stolen is made public to everybody, right? So essentially, once your data goes there, it's there. You can't do anything about it. But once you know that your data is there, you can help protect yourself, and we help you do that, right? Monitoring, and how do we make sure that we monitor your organization's data as well. We go and do dark web monitoring for your organization level, as well as for your employee level as well. We can do that as well. We're also policies, and these are important, especially when you are a bigger organization, mature organization. You need to know how to manage incidents that happen, security incidents that happen. You need to have policies in place to help protect yourself. How do you react to situations? How do you, the staff need to be trained. So you need to have proper policies in place. We'll help you with that as well. And then if you need SOC services for security incidents, if you're a bigger organization, we provide SOC services as well. So that kind of gives you an idea about the managed services and the cybersecurity services that we provide from TeamLogic IT. I just wanted to share this with you. Happy to talk to you. Give me a call, email me, and also, Ari, I'll leave it to you here.
Thanks, Ashwin, and great overview. All the different ways that we can be monitoring and auditing what's happening in our organizations across industries. So we'll open it up at this point to questions, or if Diana, if you've got anything else you want to add.
No, I am looking, I don't see any questions coming through. But I have to say, I'm so glad this is recorded. There's a lot of takeaways that just from as an employee at the chamber, I'm able to go, oh, we should be doing this. So this was very informative. I want to thank both of you for bringing your expertise to us today. I want to thank you for your time to support our local businesses. This was quite eye-opening. So I will going to go ahead and conclude today's presentation.